Hi, this is Eric Durack from Med Health Fit and our ongoing series on Ozempic and the health and fitness industry. So in a recent video, I talked about what Joe Rogan thought with his social media platform. While I was on YouTube, I actually looked at a video from Dr. Drew Pinsky, and Dr. Drew is probably one of the most famous doctors on social media today. He's also very buff as a guy in his 50s. He's really gotten into exercise and strength training. This is what he said about Ozempic. He said there's a lot of stuff going around with low carb, paleo, keto diets. He said the insulin story is the most important. We really need to be looking at insulin with people who are on Ozempic, because what he says, this is still part of the metabolic syndrome that they're involved with. So when patients are doing blood labs, he wants to see some of the hormones, including insulin. He says there's more to this story than just the drug. He says it's really a sort of a failure of the diet industry over decades, and why people are not losing weight, what he said naturally. So he says Mounjaro and Ozempic do work. They're an off-label drug. They're mostly diabetes. And he said, like what Joe Rogan had said, that people are losing an ungodly amount of lean muscle mass, which is one of the worst things that we can do. He said that it hits the gastric inhibitory enzymes. That's what's helping it reduce the hunger. However, he's not a fan either, even though he says it works. He says that patients really need to get off of the drug probably within less than a year, because once you're on it for a year, 2 years, and we're still new in this process, the long-term side effects we do not know. So the goal is not to have long-term side effects in the first place. Listening to Dr. Drew and listening to Joe Rogan, I think that they make some really good points about Ozempic and where we need to be as a society. This is Eric Durack for Med Health Fit.